In neuropsychology, we're really looking at cognitive functioning. So we're looking at memory, attention, problem solving, kind of how the brain functions in those domains. The luxury of our department is we've got a lot of extra time that we can spend with a patient. Usually we're a consult service, so patients come in, they do a lot of testing, and then we give feedback to the patient as well as providers. So we're trying to find out what labels to use, what diagnosis to use, and then give a lot of recommendations for how treatment can progress. So sometimes there's questions about, is the person ready to go back to work? Maybe there's a question about school. Maybe there's a question about living independently. And we help give some information that helps providers and patients and families better know how to address those kinds of questions. One of the favorite parts of my job is trying to figure out what's going on. It's kind of like there's a puzzle in front of me, and I'm trying to find out how the different pieces fit together. So it's a lot of investigation, it's a lot of hypothesis testing, and it's kind of fun to see how things fit, and then be able to communicate that to somebody else. So we try to tailor each evaluation to that person, to their referring question, to their history. So we're trying to be efficient in our evaluations. And I just want patients to know that it's not as scary as it might seem. We're going to take breaks as needed, so I try not to give extra tests if they're not needed. Patient-centered care is first trying to understand who the patient is, what their goals are, what their strengths are, what their weaknesses are, and really partnering with them to move forward in treatment is to be able to find out what their voice is and how to amplify that voice so that other people can hear it. One of the best things that I like about working at Semmes Murphey is the amount of autonomy that I have here. I'm not pressured by different metrics. I can spend as much time with a patient as I need. I can spend as much time on the back end doing consultation, report writing, doing extra readings to make sure that I'm doing the best care possible. And it's not just a variety of specialists, it's all specialists that are concentrating on how the central nervous system works, either the spinal cord or the brain. Iron sharpens iron. To be around some great providers in other disciplines, I feel like I'm becoming a sharper provider working around them.